In a day we can have anywhere between sort of 50 to 60 appointments, and of those probably 10 or 12 come in for operations. Can be busy. Obviously we're very dependent on what walks through the door, whether it's emergencies or routine stuff. The most common surgeries are the routine neutering, so castrations and spaying dogs and cats. That probably takes 70% of our caseload. Spay and castrate is probably most of what we're doing today, but then we fit around the emergency stuff around that. So, and we do get things like there's a little dog in the corner that's got a cancer, so we do those sort of surgeries quite routinely. So I suppose neutering most common, lumps and teeth next, and then emergency bits and pieces after that. Right, so this little dog, little Springer Spaniel's been castrated. He's already been aseptically prepared in the prep area by the nurses, so he's had his skin clipped, scrubbed with surgical spirit and an alcohol-based product, and we're now going to castrate him. So castration in a dog is removal of the testicles, compared to humans which have a vasectomy to stop them being fertile. So we're just going to, his testicles sit here in his scrotum. I'm going to push them forward so they sit underneath the skin. We're just going to make an incision over the first one in the middle. We just keep cutting down until we gently get onto the top of it. There we go. Out comes the testicle in what's called its tunic, so it's still in its sort of little sac, and then we just gently lift it up, detach the tendon off the back, and there it all is. So that's the testicle. You've got all the blood vessels, the spermatic cord and the muscle all in the middle here, and our job now is to make sure that's safely tied off so it doesn't bleed. So I'm now going to cut between these two clamps, and that's one testicle removed. And just check our stitch and let it go, and that's going to be fed back down. We're going to get the second one. Exactly the same again, push it up, gently cut over, and it should just pop out. And clean the cord off. First clamp, second clamp. Okay, so that's the castration completed.
The most rewarding thing about making them better, about being a vet, is making animals better. If you have an animal come in that has an acute surgical emergency, so something that is going to kill the animal if you don't operate on it there and then the animal goes home after it's all better, it is so rewarding. So it's really nice when you have an animal that goes from hating coming in, it has an emergency, you make it better, and it likes to come see you after that. It's quite nice.
We've been treating Radar, who's the Vizsla. He's an epileptic because he had lungworm in his brain, and he's become unstable overnight. So we're trying to stop him fitting. He's having phenobarbital intravenously, which is a sedation to try and get his brain settled down. He's already had Valium, and really we're just seeing how he goes.
The most difficult thing with being a vet is probably some surgical emergencies are really difficult. Fitting dogs, as you've seen today, is a hard thing to manage if they don't respond to treatment. The second hardest thing sometimes is speaking to clients, because you have to have just as good a communication skills with people as you do with the animals. If you have an animal in critical condition and you've given everything and they get better and they are going to live, it's priceless.